My name is Jeff Johnson, and I'm co-lead for the Empathy trial, working along with Dr. Mike Walsh from McMaster University.
Robert Brzezinski, I'm a hemodialysis patient for the last 26 years, and I got involved with the Empathy project right at the very beginning because I thought things weren't being addressed towards the patients on hemodialysis.
The overall aim of this study was to explore the usefulness of measuring and reporting the patient-reported outcome measures, or PROMs, in clinical practice in hemodialysis. The intervention we tested was really to provide a way the patients could routinely report symptoms or the burden that they experience while on hemodialysis.
Whether we've got financial problems, health, other issues, or dialysis isn't going well, these are things that should be addressed. Some people don't want to talk about this, and these are the people we must get in touch with. Using our surveys is a good indicator on how well we're doing on a particular day or a week.
We also provide nurses and physicians with a standardized report, much like a regular lab reports, and guidance for how to interpret the PROMs and to act on them clinically to alleviate those problems or concerns for the patients.
It's a long haul. I can attest with family members and people I've known over the years that we must address this, whether using our allied health workers to address these problems with these patients.
We're testing the hypothesis that this approach would lead to improved communications between patients and their healthcare team, and through that lead to reduced symptoms. We also use qualitative methods to gain insight into the patients and the nurses' experiences with the empathy intervention.
Myself with this program, along with Paul Dupont, who passed, we both felt that the mental wellness of hemodialysis patients was being neglected.
The Empathy trial is really rooted in patient engagement. Robert Brzezinski and Paul Dupont emphasized the importance of mental health concerns and of giving patients a more active voice in their overall care.
As Paul said to me, he said half the patients come into dialysis and they're fairly well adjusted, and the other half are quite depressed, and this is an issue because it deals with their health.
Other members of the Can-SOLVE team asked patients and clinicians what their priorities would be for future research. Two of the important topics were communication within the healthcare setting and concerns about mental health.
A lot of the patients don't want to talk about the mental burden that they have with hemodialysis. Dialysis just doesn't end after 4 hours of dialysis. It's a 24-hour thing that we live with.
As we finalize our analyses and the various reports, we expect them to help guide decisions at the system level about how best to incorporate the measurement and reporting of PROMs into clinical workflow in dialysis units, and do this in the most efficient way.